a first-year resident performed an emergency thoracotomy in 90 seconds, then whispered 6 words that silenced the entire trauma bay. For more stories like this, subscribe. The morning round started the way they always did, with Dr. Marcus Reeves reminding everyone exactly where they stood in the hierarchy. "You've been here 6 weeks, Dr. Brennan." His voice carried across the conference room, sharp enough to cut through the low murmur of resident chatter. "Observe, don't theorize." Olivia Brennan stood near the back, arms crossed loosely, eyes fixed on the patient chart projected on the screen. She'd noticed something in the post-op notes, a detail the overnight team had missed. Elevated white count, subtle fever pattern, complaint of abdominal tenderness that didn't match the surgical site. Early sepsis, maybe. But Reeves had already moved on, flipping to the next case, and Liv let her observation die in her throat. 6 weeks wasn't long enough to build credibility, especially not when you were starting over at 34. She uncrossed her arms and slipped out of the room before anyone noticed. The locker room was empty when she arrived, fluorescent lights buzzing overhead. Liv opened her locker and pulled out her scrubs, moving with the same efficient precision she brought to everything. She changed quickly, careful to layer a long-sleeved compression shirt beneath her scrub top before pulling it on. July in Seattle, 90 degrees outside. She adjusted the sleeves until they covered her forearms completely. "You always wear long sleeves." Liv turned. Dr. Yuki Tanaka stood in the doorway, gym bag slung over one shoulder, eyes curious but not unkind. "Even in July," Yuki added, stepping inside. Liv tugged her locker shut. "Cold sensitive." Yuki smiled slightly, unconvinced but polite enough not to push. "Right. Well, we've got a full board today." Reeves is in one of his moods. "Noticed. He's harder on you than the rest of us." Liv reached for her ID badge, clipped it to her scrub pocket. "I'll survive." Yuki paused, studying her. "That laceration repair you did yesterday, the construction worker with the radial artery nick." Liv kept her expression neutral. "What about it?" "Your hand positioning, the way you controlled the bleed before suturing." Yuki tilted her head. "That's not standard technique. Where'd you learn it?" "I study a lot of different methods." "Huh." Yuki shifted her bag higher on her shoulder. "Danny Ortiz was watching you, the paramedic, former army medic. He said something about it looking familiar." Liv's pulse didn't quicken. She'd learned a long time ago how to keep her body from betraying her thoughts. Techniques overlap sometimes. Yuki nodded slowly, then smiled. "Well, whatever you're doing, it works. That guy didn't lose more than 50 cc's. I've seen attendings lose 10 times that on similar cases." She left before Liv could respond. Liv stood alone in the locker room, staring at her reflection in the narrow mirror mounted inside her locker door. Auburn hair pulled back tight, 34 years old, but the last 3 years had carved lines around her eyes that made her look older. Tired, she closed the locker. The emergency department was chaos by mid-afternoon. Chest pain in Bay 3, pulsable stroke in Bay 5. A teenager with a compound fracture being wheeled past by ortho. Liv moved through it like water, picking up charts, checking labs, assisting where needed. She was reviewing a CT scan when the commotion started near the nurses' station. "Dr. Brennan." Reeves stood with his arms crossed, surrounded by the rest of the surgical team. He held a tablet, screen angled toward her. "Your assessment notes from last night," he said. "The multi-trauma from the motorcycle accident." Liv stepped closer. "Yes?" "You completed a full primary and secondary survey, documented 12 separate injuries, prioritized surgical intervention, and flagged 3 potential complications." He paused. "In 90 seconds." She waited. "This level of detail," Reeves continued, voice cool and measured, "in 90 seconds, suggests guessing, not proper evaluation." "I was thorough and efficient, Dr. Reeves." "Or reckless." He handed the tablet to Yuki without looking away from Liv. "Speed isn't the goal here, Dr. Brennan. Accuracy is, and accuracy requires time. My assessment was accurate. This time." Reeves straightened. "Slow down. Medicine isn't a race." The other residents watched in silence. Liv felt their eyes on her, felt the weight of judgment and curiosity pressing down like humidity. She nodded once. "Understood." Reeves turned away, dismissing her without another word. Liv returned to the workstation and pulled up her next chart. A straightforward case. Robert Lawson, 58, construction foreman. Uncomplicated cholecystitis. Gallbladder removal, laparoscopic approach, scheduled for tomorrow morning. She scrolled through his intake notes. Presented with right upper quadrant pain, radiating to shoulder. Nausea, low-grade fever. Ultrasound confirmed gallstones. Pre-op labs normal. Liv stopped scrolling. Occasional chest tightness, patient reports. Dismissed as unrelated by intake physician. She read the line again. Pain radiating to shoulder. Chest tightness. Her instincts hummed, quiet but insistent. She opened his chart further, checking his history. Hypertension, controlled. High cholesterol. Smoked for 20 years, quit 5 years ago. Cardiac risk factors. Liv picked up the phone and dialed the lab. This is Dr. Brennan. I need a troponin panel on Robert Lawson, patient ID 847293. The lab tech hesitated. Dr. Reeves already cleared him for surgery. Gallbladder cases don't usually need cardiac panels. I'm ordering it anyway. Okay, but thank you. She hung up. 2 hours later, the results came back. Troponin levels borderline elevated. Liv printed the report and found Reeves in the surgical wing, reviewing pre-op schedules. Dr. Reeves, he glanced up. Impatient. What? Robert Lawson. I ran a cardiac enzyme panel. Troponins elevated. Reeves took the paper, scanned it, handed it back. Troponin can be elevated from gallbladder inflammation. You're seeing zebras, Dr. Brennan. His pain pattern fits referred cardiac pain. We should delay surgery and run a full cardiac workup. His EKG was normal. Vitals stable. This is a textbook gallbladder case. Reeves stepped past her. Surgery proceeds as scheduled. You'll observe from the gallery. Liv stood alone in the hallway, paper still in her hand. She'd seen this before. Not the gallbladder, the dismissal, the assumption that concern equaled incompetence. She folded the report and slipped it into her pocket. If you want to see how Liv goes from dismissed resident to commanding an entire trauma response, subscribe to Emergency Heroes Stories. Comment below, have you ever had to hide your expertise to fit in? Because what happens in the next few minutes will change everything. The break room smelled like burnt coffee and disinfectant. 3 residents clustered around the small table, voices low but animated. Did you see Brennan's suture work on that forearm lac yesterday? The speaker was a second-year named Mills, stirring sugar into his coffee. Interrupted sutures, every single one. Yuki looked up from her phone. So that's military style. Civilian teaching is continuous sutures for speed. Mills leaned back in his chair. She uses battlefield techniques. Maybe she just learned it that way, another resident offered. Or maybe she watched too many MASH reruns, Mills said, grinning. Yuki didn't smile. She'd been thinking about those sutures too. About the 3-point pressure hold Liv had used to control bleeding. About the way Danny Ortiz, the paramedic, had stopped mid-conversation to watch. James Chen sat in the corner, saying nothing. 20 years as an ER nurse practitioner had taught him when to listen and when to speak. He'd seen Liv's technique too. Recognized something in the economy of her movements, the way she never wasted motion. He'd also noticed the way she adjusted her sleeves, the careful positioning of fabric over her forearms. People didn't hide things unless they had reason. By evening, the tension had thickened. Reeves called a meeting in the surgical conference room, and when Liv walked in, she knew immediately she was the subject. He stood at the head of the table, arms crossed, expression unreadable. Dr. Brennan. He gestured to the screen behind him, where her chart notes from the past week were displayed in neat columns. 6 weeks into your residency, and you're performing at a 3rd-year level. The other residents shifted in their seats. Your suture times are 40% faster than standard. Your triage assessments are eerily accurate. Your procedural confidence is, frankly, unusual for someone at your stage. Reeves paused. So I have to ask, where did you train before this? Liv kept her hands relaxed at her sides. I completed medical school at University of Washington. You have my transcripts. I do. But there's a 4-year gap between undergrad and med. Id school. Your application lists medical volunteer work abroad. He leaned forward slightly. Where abroad? Various locations, trauma-focused environments. That's vague. It was volunteer work, Dr. Reeves, not formal employment. His eyes narrowed. Your technique isn't self-taught. Someone trained you, extensively. Liz met his gaze without flinching. I prepare thoroughly for every procedure. I study multiple methods and choose what works best. In 90 seconds, experience builds speed. Experience you claim not to have. The room had gone silent. Even Mills, usually quick with a joke, stared down at the table. Reeves straightened. I'm assigning you a case tomorrow. Routine gallbladder removal. Robert Lawson, the patient whose cardiac panel you unnecessarily ordered. His troponin was elevated, within acceptable variance for preoperative inflammation. Reeves picked up a tablet and handed it to her. You'll perform the procedure under direct supervision. Since you're so confident in your speed, let's see you handle a textbook case without improvising. Liv took the tablet. Understood. Observation only on the approach. I'll be primary surgeon. You assist and learn. He turned to the rest of the residents. The rest of you will observe from the gallery. Pay attention to proper technique and pacing. It wasn't an opportunity. It was a public examination. Liv nodded once and left the room. She spent the evening in the on-call room reviewing Lawson's chart again. 58 years old, construction foreman, 23 years on the job. Married, 3 kids. Complained of right upper quadrant pain for 2 weeks before finally coming in. Uncomplicated cholecystitis, according to every attending who'd reviewed the case. But the details nagged at her. Sharp pain radiating to shoulder, occasional chest tightness, dismissed as anxiety. Elevated troponin, dismissed as inflammation. Liv pulled up his EKG from intake. Normal sinus rhythm, no ST changes, no Q waves. But EKGs could be normal even with underlying ischemia, especially in patients with good collateral circulation. She closed the chart and stared at the ceiling. You're seeing zebras, Reeves had said. Maybe. Or maybe she'd just seen enough zebras to recognize the pattern. The next morning, she arrived in pre-op at 6. Lawson was already prepped, IV in place, vitals stable on the monitor. He looked tired but calm, the kind of calm that came from years of physical work and straightforward problem solving. You're Dr. Brennan? He asked. I am. They said you're the one who ordered the extra heart test. Liv adjusted her surgical cap. Just being thorough. My heart's fine, Lawson said. It's the gallbladder that's the problem. She nodded but didn't argue. Patients often knew their bodies better than doctors gave them credit for, but they also missed the things happening quietly beneath the surface. We'll take good care of you, she said. Reeves entered, already gloved, mask in place. He glanced at Liv, then at Lawson. Ready? Ready, Lawson said. They wheeled him into the OR. Liv stood to the side as the anesthesiologist intubated and draped the patient. Reeves positioned himself at the table, the rest of the surgical team moving into their roles with practiced efficiency. Yuki and 2 other residents watched from the gallery above, faces pressed close to the glass. Scalpel, Reeves said. The procedure began. Laparoscopic approach, 4 small incisions, camera inserted to visualize the gallbladder. Reeves narrated each step, his voice steady and pedagogical. Liv assisted, passing instruments, maintaining retraction, staying silent. 4 minutes in, the monitor beeped. Seeing some irregularity, the anesthesiologist said. Eyes on the EKG readout. Reeves didn't look up. Anesthesia response. Compensate. The beeping continued, rhythm slightly off. Liv glanced at the monitor. ST segment changes, subtle but present. Her pulse didn't quicken. She'd learned long ago to keep her body calm, even when her mind was racing. Dr. Reeves, she said quietly. Not now, Dr. Brennan. The EKG is being managed. Reeves continued dissecting adhesions around the gallbladder, movements precise and unhurried. The irregularity worsened. Liv stepped closer to the monitor. The ST changes were spreading, lateral leads showing depression. She'd seen this exact pattern before. Kandahar, 2019. A pilot having an MI during a high-altitude extraction. The same subtle progression, the same initial dismissal as stress response. He'd arrested. 4 minutes later. Dr. Reeves, that's not anesthesia response. Her voice stayed level. He's having an MI. Reeves paused, finally looking at the monitor. His pre-op EKG was normal. Ischemia doesn't always show until stress. His pain pattern, the troponin, the alarm screamed. Lawson's heart flatlined. The room erupted into controlled chaos. The anesthesiologist called the code. Nurses moved into position. Reeves stepped back from the table. Start compressions, he ordered. Charge the defib. Push epi. Liv didn't move toward the table. She moved toward the door. Dr. Brennan, where are you? She was already through the scrub room, stripping gloves, hitting the intercom for the gallery. Open thoracotomy tray, now. Yuki's voice crackled back. What? He's got 90 seconds before brain damage. Get the tray. Liv regloved in 8 seconds, pushed back into the OR. Reeves stared at her. We follow ACLS protocol. He needs direct access. Scalpel. Brennan, you are not authorized. Scalpel. James Chen, standing near the instrument tray, met her eyes. Something passed between them, a recognition older than protocol. He handed her the blade. Liv's hands moved before her mind could second-guess the decision. Left fifth, intercostal space. Single incision, clean and decisive. The scalpel cut through skin, fascia, muscle in one continuous motion. No hesitation, no tremor. Blood welled up, but she was already moving to the next step. Rid spreader. James Chen had it ready. He'd seen something in her eyes, something that told him to trust what came next, even if it defied everything he'd been taught about chain of command. The spreader clicked into place. 12 seconds since the first cut. Reeves stood frozen, one hand still hovering over the defibrillator paddles. Around him, the surgical team had gone silent, watching this first-year resident crack open a man's chest like she'd done it 1,000 times before. Because she had. Liv's gloved hands entered the thoracic cavity, moving with absolute certainty. She visualized the anatomy without needing to see it first. Heart, pericardium, great vessels. Left anterior descending artery, somewhere beneath her fingers. Blocked and killing tissue with every passing second. She found the heart. Still. Lifeless. Manual compressions, she said. Not to anyone in particular, just stating what came next. Her hands wrapped around the organ, squeezing in rhythm. Direct cardiac massage, the kind of intervention that existed in the space between life and death, used only when everything else had failed. Reeves finally found his voice. What are you doing? Buying time. Liv didn't look up. The blockage is in the LAD, I can feel it. You can't possibly. James, I need a Fogarty catheter. The smallest you have. James Chen moved before Reeves could countermand the order. He'd worked in sealed hospitals during his Navy years, back when the rules were simpler. Save the life in front of you. Worry about paperwork later. He placed the catheter in Liv's palm. She threaded it with one hand while maintaining compressions with the other, a feat of coordination that shouldn't have been possible. The catheter entered the coronary artery, guided by touch and memory and 8 years of doing exactly this under conditions far worse than a sterile operating room. The balloon inflated. The blockage shifted. Blood flow resumed. Lawson's heart stuttered, then beat. Once, twice, a rhythm emerging from nothing. The monitor began beeping again, erratic at first, then steadying into something almost normal. Liv maintained compressions for another 10 seconds, feeling the organ strengthen under her hands. Cardiac output improving, perfusion returning. She stepped back. The room remained silent except for the steady beep of the monitor and the hiss of the ventilator. Lawson's heart beat on its own now, color returning to the tissue, oxygen flowing where moments ago there had been none. 90 seconds, first incision to sustained cardiac output. Liv stripped her gloves and dropped them in the waste bin. Her hands were steady. They always were during the procedure. The shaking came later, in private, when no one was watching. LAD blockage cleared, she said, voice flat and professional. He's stable for transfer to the cardiac suite. The cardiothoracic team arrived 30 seconds later, summoned by James Chen during the procedure. They stared at the open chest, at the surgical field that should have been a disaster, but instead looked like something out of a textbook. Dr. Patricia Okonkwo, chief of cardiothoracic surgery, stepped to the table. She looked at Lawson's heart, beating steadily now. Looked at the incision, clean and precise. Looked at Liv. Who performed the thoracotomy? Reeves opened his mouth, but nothing came out. I did, Liv said. Okonkwo examined the surgical site more closely. Single incision, perfect placement, minimal tissue trauma. She glanced up. How long have you been doing emergency thoracotomies? Long enough. That's not an answer. Liv met her gaze. He was dead. Now he's not. That's the answer that matters. Okonkwo studied her for a long moment, then nodded. We'll take him from here. Beautiful work, Dr. Brennan. She gestured to her team, and they moved in to prepare Lawson for transport. The OR emptied slowly. Nurses, techs, the anesthesiologist, all filing out with backward glances at Liv, at Reeves, at the space where something impossible had just become real. Finally, only Liv and Reeves remained. He stared at her like he was seeing a stranger. Where did you learn that? Liv pulled off her surgical cap. Her hair fell loose, strands sticking to her forehead with sweat. Training. That wasn't civilian training. No. Then what was it? She walked toward the scrub room, already untying her surgical gown. I'll write up the incident report. Dr. Brennan. She stopped but didn't turn around. You just performed a procedure that most attending surgeons wouldn't attempt. You did it in 90 seconds. You didn't ask permission, didn't consult the hierarchy, didn't follow any protocol I've ever taught. His voice wasn't angry. It was something else. Confused, maybe awed. Who are you? Liz looked back over her shoulder. Someone who doesn't give up when the monitor flatlines. She left him standing alone in the empty operating room. The gallery had emptied too. But Yuki caught up with Liv in the hallway outside the scrub room. That was incredible. Liv kept walking. It was necessary. Where did you learn to do that? And don't say studying. Nobody learns that from textbooks. Experience. What kind of experience? Liv stopped, turned to face her. Yuki was persistent, had been since day one, always watching, always asking questions. In another context, Liv might have appreciated the curiosity. Here, it was a liability. The kind that teaches you to act when everyone else freezes. That's not an answer. It's the only one you're getting. Liv turned and walked away, leaving Yuki standing in the hallway, questions still unasked on her lips. In the locker room, Liv sat on the bench and stared at her hands. They'd stopped shaking already. Muscle memory, adrenaline management, the thousand small techniques she'd learned to keep her body under control when her mind wanted to spiral. She pulled up her sleeve and looked at the burn scars on her left forearm. 3 inches long, puckered tissue from a fuel fire. Kabul, 2021. The helicopter going down, flames spreading faster than water could contain them. She'd pulled 8 soldiers out of that wreckage. There had been 2 children, local allies' kids, evacuation priority. She'd run out of time. Liv pulled her sleeve back down and closed her eyes. The door opened. James Chen stepped inside. Paused when he saw her. You okay? Fine. He sat down on the bench across from her. I was Navy, 20 years, saw a lot of combat medicine. He leaned forward, elbows on his knees. I recognized what you did in there. That wasn't improvisation. That was training. Liv didn't respond. You don't have to tell me anything, James continued. But if you ever need someone who understands, I'm here. She looked at him, really looked. Saw the same weight in his eyes that she carried in her own. Thank you, she said quietly. He nodded and stood to leave. At the door, he paused. For what it's worth, you saved that man's life. Don't let Reeves make you feel like you did something wrong. Then he was gone. Liv sat alone for another 5 minutes, letting the silence settle around her like a blanket. Her pager buzzed. She checked it. Message from administration. Report to Dr. Reeves' office immediately. Liv stood, adjusted her sleeves one more time, and headed upstairs. Reed's office was on the 4th floor, tucked between administrative suites and the surgical library. Liv had never been inside. First-year residents rarely were, unless something had gone very wrong or very right. She knocked once. Come in. Reeves sat behind his desk, hands folded, expression unreadable. The window behind him overlooked the ambulance bay, where emergency vehicles came and went in a constant rhythm of crisis. Sit. Liv sat. For a long moment, neither of them spoke. Reeves studied her like she was a puzzle he couldn't solve, pieces that didn't fit the picture he'd constructed. I've been reviewing your file, he said finally, thoroughly this time. Liv waited. You're 34 years old. Most residents start at 26, 27. You started medical school at 29. He opened a folder on his desk. 4 years older than average, which means there's a gap. 2013 to 2021. 8 years. I worked before medical school. Doing what? Medical services. Trauma-focused. Where? Liv met his eyes. Various locations abroad. That's deliberately vague. It's accurate. Reeves leaned forward. Dr. Brennan, what you did in that operating room today wasn't luck. It wasn't improvisation. You performed an emergency thoracotomy with the confidence of someone who's done it dozens of times. He paused. James Chen said your technique was military. James Chen doesn't know my background, but he recognizes it. Reeves tapped the folder. Your application says medical volunteer work. That's not what this was, is it? Liv stayed silent. You were military, Reeves said. It wasn't a question. Before Liv could answer, the fire alarm shrieked through the building. Not the building alarm, the emergency alert system. Reeves' desk phone rang simultaneously. He grabbed it, listened for 3 seconds, his face draining of color. Understood. All available personnel. He hung up and stood. Mass casualty incident. Bridge collapse on I-5. Multiple vehicles in the water. Estimated 30-plus casualties inbound. Liv was already moving toward the door. They ran. The trauma bay transformed in seconds. Nurses cleared non-critical patients. Techs wheeled in extra equipment. Residents assembled in triage formation. The attending physicians positioned themselves at trauma bays 1 through 6, preparing for the onslaught. The first siren wailed outside, then another, and another. 6 ambulances arrived simultaneously, doors flying open, paramedics shouting vitals and mechanisms of injury. The organized chaos of mass casualty response filled the space with sound and motion, and the particular electricity that came from too many people needing help at once. Danny Ortiz burst through the ambulance bay doors, hands still doing compressions on a patient strapped to the gurney. Male, late 20s, military ID and wallet, truck crushed by concrete beam. He shouted over the noise. Flail chest, suspected cardiac tamponade, BP 60/40, and dropping fast. They rushed past Liv toward Trauma Bay 2. She caught a glimpse of the patient's face. Young, pale, lips already cyanotic, and conscious. Barely, but his eyes were open, tracking movement with the desperate awareness of someone who knew exactly how badly injured they were. Those eyes found Liv. The patient's hand shot out, grabbed her wrist with surprising strength. "Night Stalkers," he whispered. Liv froze. Danny kept moving, but the patient held on, pulling Liv closer. "You're Brennan." His voice was barely audible over the chaos. "Captain Brennan, you pulled me out. Kandahar, 2019. Every sound in the trauma bay seemed to fade. Liv stared at the face, trying to place it among the hundreds of faces she'd worked on during 3 tours. "Extraction mission," the patient continued, each word costing him. "Black Hawk down. You stayed. You wouldn't leave." The memory surfaced. Night operation. Pilot injured during emergency landing. Hostile fire closing in. She'd stayed on the ground doing emergency surgery while the rest of the team provided cover. Staff Sergeant Eric Holloway. 23 years old then. Special Forces. Multiple deployments. "Eric," she said quietly. He smiled, just barely. "Told you I'd remember." Danny had stopped moving. He stared at Liv, then at Eric, pieces connecting in his mind. Reeves appeared beside them. "What's the delay? Get him to Trauma 2. "Yes, sir." Danny started moving again, but his eyes stayed on Liv. Eric's grip loosened on her wrist. "Don't let me die, Captain." "I won't." They wheeled him away. Liv stood motionless, the weight of her past suddenly present in a trauma bay in Seattle, thousands of miles from the desert where she'd buried it. Reeves grabbed her shoulder. "You know that patient?" "Yes." "From where?" "Afghanistan." His expression changed. Not surprise, exactly. Confirmation of something he'd already suspected. "Expected. You were deployed." Liv pulled her arm free from his grip. "He's crashing. I need to operate. You're a first-year resident. He's got minutes, maybe less. We have attending surgeons who don't know his medical history." Liv turned to face him fully. "I do. I operated on him once before. I know his anatomy, his complications, his risk factors. That matters." Reeves hesitated. Around them, the trauma bay roared with activity. Every attending was already occupied, hands deep in their own critical cases. The second wave of ambulances was arriving, more patients flooding in. Danny appeared at Reeves' shoulder. "Dr. Reeves, she's right. If she knows his history, that's valuable intel." Intel, military terminology, spoken without thinking. Reeves looked at Eric, at the monitors showing blood pressure continuing to drop, at the other trauma bays already full. "Fine," he said, "but I supervise." Liv was already moving. No time for supervision. She reached Trauma Bay 2 as Derek's blood pressure hit 50/30. Cardiac tamponade. Blood filling the pericardial sac, compressing the heart, preventing it from pumping effectively. Every second delayed was tissue dying. "Pericardiocentesis kit," Liv said, her voice cutting through the noise with absolute authority. The nurse had it ready in seconds. Liv didn't pause to explain, didn't wait for Reeves to approve. She positioned the needle below the xiphoid process, angled upward toward the left shoulder, advanced it with steady pressure. She felt the resistance, then the give as the needle entered the pericardial space. Dark blood filled the syringe. 60 milliliters, 80, 100. Eric's blood pressure climbed. 60/35, 70/40, 80/50. Color returned to his face. How did you know the exact entry point without imaging? Reeves stood beside her, watching. I've done this 47 times. 47, yes. She withdrew the needle, applied pressure to the insertion site. Eric's vitals continued stabilizing on the monitor. But the flail chest remained. Multiple rib fractures, paradoxical chest wall movement, underlying lung damage. He needed surgery, and he needed it now. Prep for thoracotomy, Liv said. He's got posterior rib fractures causing pulmonary contusion. We need to stabilize the chest wall and check for internal bleeding. Reeves stared at her. How do you know about posterior fractures? We haven't done imaging yet. Mechanism of injury: concrete beam from above, patient pinned against steering wheel. Force distribution causes anterior and posterior fracture patterns. It's textbook. It's military textbook. Liv looked at him. Does it matter where I learned it if it saves his life? Reeves held her gaze for 3 seconds. Then he stepped back. Trauma 2 is yours. I'll assist. For more stories about the courage to act when seconds matter, subscribe to Emergency Heroes Stories. Comment below. What would you do if your past came back in the middle of saving a life? Because what happens next will reveal everything Liv has been hiding. The operating room lights blazed overhead as they wheeled Eric Holloway in. His vitals had stabilized enough for transport, but the flail chest made every breath a visible struggle. The paradoxical movement of his chest wall looked wrong even to untrained eyes. Liv scrubbed in beside Reeves, their movements synchronized but silent. Through the observation window, Yuki and 2 other residents watched, faces pressed close to the glass. Anterior approach, Liv said as she gloved. We need to stabilize the fractured segments and assess for hemothorax. Reeves nodded. For once, he wasn't questioning her. They draped Eric and prepped the surgical field. The anesthesiologist called out stats: BP holding an 85/55, oxygen saturation at 91%, heart rate elevated but steady. Scalpel. Liv made the incision. Muscle memory guided her hands, the same movements she'd performed in field hospitals where the lights flickered and mortars landed close enough to shake the equipment. But this wasn't a field hospital. This was supposed to be different. She exposed the fractured ribs, multiple segments displaced and mobile, worse than the initial assessment suggested. Jesus, Reeves muttered. How is he still breathing? Adrenaline and training. Liv's hands moved quickly, assessing the damage. Special Forces operatives have higher pain tolerance and respiratory compensation. He's been holding his breath in patterns to minimize movement. You can tell that from looking? I can tell that from experience. She began the stabilization process, placing plates and screws to restore the structural integrity of the chest wall. Each movement was precise, economical, no wasted motion. Reeves assisted, but mostly he watched. Your technique, he said quietly. It's not just military. It's specialized military. Liv didn't respond, focused on placing the next screw. Combat surgery, Reeves continued. Forward operating base, probably. Somewhere with limited resources and high acuity. Afghanistan, Iraq, both. The admission came out flat, factual. Reeves paused. How long? 8 years, 3 tours. What unit? Liv secured another plate before answering. 160th Special Operations Aviation Regiment. The OR went quiet except for the beep of monitors and the hiss of the ventilator. Yuki's voice came through the intercom from the gallery. The Night Stalkers? Liv glanced up briefly, then returned to the surgery. Yes. You were a flight medic, Reeves said, understanding dawning. You performed surgery in helicopters. When necessary. How many? Procedures or missions? Both. Liv placed the final stabilization screw. 614 surgical procedures. 237 medical evacuation missions under fire. The number hung in the air like smoke. She moved to assess the lung tissue beneath the now stabilized ribs. Moderate contusion, some bleeding, but manageable. She irrigated the chest cavity, placed a drainage tube, began closing. Eric stirred slightly under anesthesia, and the anesthesiologist adjusted the sedation. Stay with us, Sergeant, Liv said quietly. You've survived worse. His vitals strengthened as she worked. Reeves watched her suture the incision. The same interrupted pattern he'd criticized days ago. Now he understood why. Field surgery required sutures that could withstand movement, infection, less than ideal healing conditions. Continuous sutures were faster, but more vulnerable to complete failure if compromised. Interrupted sutures meant if one failed, the rest held. You learned to operate expecting the worst-case scenario, he said. I learned to operate guaranteeing the best outcome regardless of circumstances. She finished the final suture and stepped back. Eric's chest rose and fell normally now, the paradoxical movement gone. His oxygen saturation climbed to 97%. Blood pressure normalized. Surgery complete, Liv announced. Patient is stable for recovery. The OR team began the process of transferring Eric to post-op. But before they could move him, his eyes opened. The anesthesia hadn't fully taken hold, or his body was fighting it off through sheer will. He looked directly at Liv. You stayed, he whispered. Barely audible. What? Reeds asked. Kabul. Eric's hand moved weakly, reaching for nothing. The bird went down. You stayed when everyone said to evac. Liv removed her surgical gloves slowly, precisely. You need to rest, Eric. 8 of us. You pulled out 8. His eyes were unfocused but insistent. The children, you tried. You wouldn't leave them. The room temperature seemed to drop. That's enough, the anesthesiologist said, increasing sedation. Let him rest. But the damage was done. Every person in that OR had heard. Eric's eyes closed and his breathing deepened into unconscious rhythm. Liv walked out without a word. Reeves followed her into the scrub room. What happened in Kabul? She stripped off her surgical gown, methodical and controlled. We extracted wounded personnel during the evacuation. August 2021. And our helicopter was shot down. We crashed into the Kabul River. Liv scrubbed her hands. The water running cold. She didn't feel it. I pulled out 8 soldiers. There were 2 children. Afghan allies' family members. I ran out of time. Her voice stayed level, clinical, like she was describing someone else's story. How much time? Reeves asked quietly. By the time I got the 8th soldier out, the children had been underwater for 11 minutes. I tried resuscitation for another 7. They were already gone. She dried her hands and turned to face him. I was ordered to abandon the extraction after 6 minutes. I refused. Stayed 18. If I'd followed orders, maybe those children would have had a chance. Or maybe you'd be dead, and all 8 soldiers with you, Reeves said. Liv's expression didn't change. That's what the after-action report concluded. Didn't feel like it at the time. Before Reeves could respond, the trauma bay doors burst open. Danny Ortiz's voice carried through the hallway. Incoming. Bridge collapse survivor just pulled from the water. 6-year-old female, hypothermic, near drowning, massive crush injuries. ETA, 90 seconds. Liv's face went white. Dr. Brennan, Reeves started. She was already moving, walking toward the trauma bay with steps that looked automatic, like her body was responding to training even while her mind processed something else entirely. 6 years old. Water. Crush injuries. Reeves caught up to her. We have pediatric specialists. Not with cold water immersion and crush injury experience. Her voice was distant. That's a specific combination. You've treated it before. Liv stopped walking, looked at him. Paktika Province, 2018. Forward Operating Base Sharana. I ran the only pediatric trauma program in the region for 14 months. Why didn't you list that in your application? Because I came here to forget. The ambulance sirens wailed closer. Liv turned back toward the trauma bay. But forgetting doesn't help anyone. She walked through the doors as the ambulance pulled up, and Reeves saw something change in her posture. The reluctance disappeared. The weight lifted. This was who she was trained to be. The question was whether she'd let herself be that person again. The ambulance doors opened, and paramedics rushed out carrying a small body wrapped in thermal blankets, soaking wet, unmoving. Behind them, a man stumbled out, also wet, screaming. Emma, my daughter. I couldn't reach her. The car filled so fast. The trauma team assembled. Dr. Linda Morris, chief of pediatric surgery, took one look at the girl and her face went pale. Core temp is 89 degrees. Pulse barely detectable. She's been down for at least 12 minutes. Liv stepped forward. I can help. Morris looked at her. You're not pediatric certified. I'm certified in pediatric combat trauma. Cold water immersion with crush injuries. I've treated this exact presentation. Morris hesitated, looking at the girl. at the monitors, at the impossible situation in front of her. "Please," Liv said quietly. "Let me try." Emma Patterson was 6 years old and looked like she was already dead. Her skin had taken on the grayish-blue pallor of severe hypothermia, lips dark purple, small chest motionless beneath the thermal blankets. The paramedics had done their job getting her here, but everyone in the trauma bay knew the statistics. Core temperature of 89 degrees, submersion time over 12 minutes, pediatric crush injuries. The odds weren't just bad, they were almost non-existent. "Doctor." Morris stood at the head of the gurney, hands hovering over Emma's small body, like she was afraid to touch something already broken beyond repair. Reeves appeared beside Liv. "If you can do this, do it now." Liv stepped to the table. "Everyone listen carefully," she said, her voice cutting through the ambient noise with the same authority she'd used in field hospitals when incoming wounded outnumbered available hands. "We do not attempt rapid rewarming. Hypothermia is protecting her brain right now. We warm her slowly through ECMO while we address the crush injuries." Morris looked up. "ECMO will take 20 minutes to prep. Then we prep it now. Start 2 large-bore IVs, type and cross for 6 units, and get me an ultrasound. I need to see what we're dealing with internally before we move her." The team jumped into motion. Yuki appeared at Liv's side. "What do you need from me?" "Check extremities for compartment syndrome. Crush injuries cause swelling that cuts off blood flow. We might need emergency fasciotomy." Yuki moved to Emma's legs, palpating carefully. "Left leg feels tight. Pressure seems elevated." "Mark it. We'll address it as soon as she's stable enough." James Chen wheeled in the ultrasound machine. Liv took the probe and moved it across Emma's abdomen, watching the screen with the focused intensity of someone reading a language most people didn't speak. Fluid in the abdominal cavity. Free fluid meant bleeding. She moved the probe higher. Pericardial effusion. Not massive, but present. The heart was compressed, struggling. "She's got a pericardial effusion and probable splenic injury," Liv announced. "We need to drain the pericardium first, or the heart won't have room to beat when we rewarm her." Morris stepped closer. "You want to perform a pericardiocentesis on a hypothermic 6-year-old? I want her to survive." Liv positioned the ultrasound probe to guide needle placement. "At this temperature, her heart is barely beating. When we rewarm, cardiac output will increase. If there's no room for the heart to expand, she'll arrest." She looked at Morris. "I've done this before. Please trust me." Morris held her gaze for 3 seconds that felt like an hour. Then she stepped back. "The patient is yours, Dr. Brennan. We'll follow your lead." Liv nodded once. "James, pericardiocentesis kit. Smallest gauge needle we have." He had it ready in seconds. Liv positioned the needle below Emma's tiny sternum, using the ultrasound for real-time guidance. Her hands were absolutely steady. In her peripheral vision, she could see Reeves watching from the doorway, could feel the weight of every person in the trauma bay holding their breath. The needle advanced. 1 millimeter, 2, 3. She felt the give as it entered the pericardial space. Dark blood filled the syringe. 20 milliliters, 30. The pressure around Emma's heart decreased with every milliliter removed. On the monitor, the weak cardiac rhythm strengthened slightly. "ECMO is ready," a tech called from across the room. "Start the circuit," Liv said, withdrawing the needle carefully. "Slow rewarming. 1 degree every 30 minutes. Any faster and we risk arrhythmia." They connected Emma to the ECMO machine, her blood cycling through external oxygenation and gradual warming. The temperature readout began climbing. 89.2, 89.5. Yuki prepped for fasciotomy, left leg, lateral approach. While the ECMO worked, Liv made a swift incision along Emma's left leg, releasing the pressure built up in the muscle compartment. Blood flow returned immediately, the tissue beneath pinking up as oxygen reached areas that had been starved. "Abdominal pressure next," Liv said. "I need to visualize the spleen." She made a midline incision, small and precise, opening Emma's abdomen just enough to assess the damage. The spleen was lacerated, bleeding slowly but steadily into the abdominal cavity. "Grade 3 tear," Liv said. "We can save it. Hemostatic agent and compression." She packed the area with surgical sponges soaked in clotting factor, applying gentle pressure. In an adult, she might have removed the spleen entirely, but children needed their spleens, needed the immune function they provided. She would save it if she could. The temperature continued climbing. 91 degrees, 92. Emma's heart rate picked up, moving from barely detectable to weak but present. Come on, Liv whispered. You're stronger than this. I know you are. 94 degrees. Emma's chest moved. A breath. Small, shallow, but independent of the ventilator. The monitor showed improving cardiac output. 96 degrees. Emma's eyes fluttered. The trauma bay went silent except for the beep of monitors and the mechanical hum of the ECMO machine. Emma's eyes opened, unfocused, confused, but alive. Daddy, she whispered. Her father, who had been restrained in the corner by security, broke free and rushed to the table. Emma! Oh God, Emma! Dr. Morris stared at Liv, with an expression somewhere between shock and reverence. I've never seen anything like that. Reeves stepped into the room fully now. 23 minutes from arrival to spontaneous respiration. That's impossible. It's not impossible. Liv stepped back from the table, stripping off her gloves. It's just specific. Cold water immersion provides neuroprotection. Crush injuries are manageable if you address compartment syndrome early. Pediatric physiology is resilient if you don't give up. She looked at Emma, small and fragile, but breathing on her own now. I learned that in Paktika province. Forward Operating Base Sharana, 2018 to 2019. Her voice carried to every corner of the room. I was the only pediatric trauma surgeon in the region. I treated 47 children with similar injuries. 43 survived. Morris approached her. You never mentioned pediatric specialization. I came here to practice adult medicine. Liv watched Emma's father crying over his daughter. I thought I was done with children. Why? Reeves asked. Because the 4 who didn't survive were burned into my memory. Because I saw their faces every time I closed my eyes. She paused. 2 of them died in Kabul, in the river, while I was trying to save everyone at once. The room stayed quiet. But Emma's alive now because I didn't forget. Liv looked at Reeves. Because I couldn't forget, no matter how hard I tried. She pulled off her surgical gown and walked toward the scrub. Room, Dr. Brennan. Reeves' voice stopped her. Who are you really? Liv turned back. Captain Olivia Brennan, 160th Special Operations Aviation Regiment, United States Army. She met his eyes without hesitation. Combat surgeon, flight medic, 8 years active duty, 3 tours, Afghanistan and Iraq. She took a breath. Certified in forward surgical team operations, mass casualty triage, high-altitude medicine, and pediatric combat trauma. Over 600 surgical procedures performed in active combat zones, 94% survival rate. The numbers fell like stones into still water. I've operated in helicopters under fire, in field hospitals with no power, in caves with headlamps and improvised equipment. Her voice stayed level, but something underneath it cracked. I've held children while they died because the supply convoy was 3 days late. I've performed amputations on 19-year-old soldiers who would never walk again. I've made choices about who lives and who dies based on nothing but gut instinct and inadequate information. She looked around the trauma bay, at the clean floors and functioning equipment and abundant resources. I came here because I wanted to practice medicine without those choices, without the sound of mortars and the smell of burning fuel and the weight of deciding who gets the last unit of blood. Emma coughed, and her father held her closer. But tonight, Emma Patterson needed exactly who I was trained to be. Liv's voice softened. So did Robert Lawson. So did Eric Holloway. So why hide it? Morris asked gently. Because every time I operated, I saw the faces of the ones I couldn't save. Liv looked at her hands. I thought if I started over, if I learned civilian protocols and worked in a place where the worst trauma was a car accident instead of a firefight, maybe I could be just a doctor instead of a soldier. Reeves stepped closer. You are just a doctor. You're exactly the kind of doctor medicine needs. Liv shook her head. I'm the kind of doctor who breaks rules and ignores hierarchy and performs procedures she's not authorized for. You're the kind of doctor who saves lives when everyone else has given up. The words hung between them. Reeves extended his hand. I owe you an apology I don't have adequate words for. I saw a first-year resident. I should have seen a surgeon. Liv looked at his hand, then shook it. You saw what I showed you. That was deliberate. Then show us the truth from now on. The conference room on the 5th floor felt different at 3 a.m, quieter. The fluorescent lights hummed overhead, and through the windows, Seattle glowed with scattered light, the city that never fully slept even when it pretended to. Liv sat across from Reeves, exhaustion settling into her bones like sediment. Emma Patterson was stable in the pediatric ICU. Eric Holloway was awake and demanding to see her. Robert Lawson was recovering in cardiac care, telling anyone who would listen about the resident who'd cracked his chest open and saved his life. 3 impossible saves in less than 12 hours. Reeves had requisitioned coffee from somewhere. Real coffee, not the sledge from the break room. He poured 2 cups and slid one across the table. "I spent the last 2 hours reading your actual military file," he said. Dr. Okonkwo pulled strings with the VA liaison office. Liv wrapped her hands around the cup but didn't drink. And you didn't just serve. You were decorated. 3 Army Commendation Medals, 2 Bronze Stars, a Meritorious Service Medal. He paused. "Those aren't participation awards. They're not why I operated." "I know." Reeves leaned back in his chair. "The citations are remarkable. One describes you performing a field amputation under mortar fire while your position was being overrun. You saved the patient and held your ground until reinforcements arrived." Liv stared at the coffee. His name was Corporal James Peterson, 22 years old. Lost his right leg below the knee, but kept his life. Last I heard, he was coaching high school basketball in Ohio. "You remember all of them? The ones who lived and the ones who didn't." She finally looked up. "The ones who died outnumber my age. That's not a ratio anyone should carry." Reeves set down his cup. The file also mentions Kabul, August 15, 2021. Medical evacuation helicopter shot down during the withdrawal. Liv's jaw tightened. "You already know that part." "I know what Eric Holloway said. I want to know what actually happened." She was quiet for a long moment, and Reeves didn't push. Outside, an ambulance siren wailed past, distant and fading. "We were extracting wounded from the airport," Liv said finally. 8 American soldiers, 2 Afghan children whose parents had worked as translators. The children were priority targets. If we didn't get them out, they'd be killed within hours. She took a breath. "We took fire on approach. RPG hit the tail rotor. We went into the Kabul River, full submersion in under 30 seconds. Her voice stayed clinical, detached. "I got the side door open, started pulling people out. The soldiers first because they were conscious and could help. Then I went back for the children." "How deep was the water?" 14 feet where we landed. Cold. Fast current. Reeves did the math in his head. 14 feet. Darkness. Cold water. Injured passengers. "I pulled out 8 soldiers in 9 minutes," Liv continued. "By the time I reached the children, they'd been underwater for 11 minutes. I tried resuscitation for 7 more. They were already gone." "You were ordered to evacuate after 6 minutes," Reeves said, referencing the file. "You refused a direct order. If I'd left after 6 minutes, 3 of those soldiers would have drowned. And the initial after-action report blamed you for the children's deaths." Liv's expression hardened. "The report said I compromised the mission by refusing evacuation orders. That if I'd followed protocol, the children might have survived. That report was overturned. 6 months later, after the investigation concluded that following orders would have resulted in 11 deaths instead of 2. She looked at Reeves directly. "But the children were still dead, and I was still the one who chose to save soldiers first. You made the right call. Tell that to their parents." The silence stretched between them. Reeves leaned forward. "Is that why you left? Because of the report?" "I left because I was tired." Liv's voice dropped. "Tired of choosing who lives. Tired of operating with inadequate supplies. Tired of seeing children caught in wars they didn't start." She paused. "I thought civilian medicine would be different. Cleaner. Less impossible. Medicine is never clean. But at least here the injuries aren't deliberate." She gestured toward the window, toward the city beyond. "Car accidents, bridge collapses, heart attacks. Those are tragedies, not atrocities." Before Reeves could respond, the door opened. A woman in army dress uniform stepped inside. Older, maybe 50, with silver eagles on her shoulders and a bearing that suggested she'd earned every rank the hard way. "Colonel Sarah Voss," she said, extending her hand to Reeves. "Army Medical Corps Liaison. I apologize for the hour." Reeves stood, shook her hand. "Dr. Marcus Reeves, Chief of Trauma Surgery." Voss turned to Liv. "Captain Brennan, it's been a while." Liv stood slowly. "Colonel, I brought something you should see." Voss placed a folder on the table. "Classified until 6 months ago. Recently declassified as part of the Afghanistan withdrawal review. She opened it. Inside your documents, photographs, transcripts of radio communications. Liv recognized some of them. The Kabul incident, the helicopter crash, the river. But there were other documents she'd never seen. The intelligence that led to your evacuation mission was faulty, Voss said. Deliberately faulty. An embedded asset was feeding misinformation to delay high-value evacuations. Liv stared at the pages. What? The children you were sent to extract were already targeted. The helicopter route was compromised before you took off. Voss pointed to a radio transcript. This communication, logged 14 minutes before your departure, warned command that the route was hot. It was ignored. Reeves read over Liv's shoulder. Someone knew the helicopter would be shot down. Not someone. Multiple someones. There was a systemic failure at every level of command. Voss looked at Liv. You were set up to fail, Captain. And when you refused to fail completely, they blamed you for the parts you couldn't control. Liv's hands trembled as she turned pages. Orders countermanded. Intelligence suppressed. Warnings unheeded. Why are you showing me this now? Because you deserve to know the truth. And because the Army owes you an apology that will never be adequate. Voss closed the folder. Those children's deaths weren't your fault. You did everything humanly possible with the information and time you had. Liv sat down slowly, the weight she'd carried for 3 years suddenly shifting. Not disappearing, but redistributing into something she could finally see clearly. The official record has been corrected, Voss continued. Your service record now reflects the full context, and there's something else. She pulled out another document. Dr. Patricia Okonkwo, your hospital's chief of staff, reached out to the VA about developing a trauma training program for transitioning military medical personnel. Voss slid the paper across. The Army wants to partner with this hospital, and we want you to lead it. Liv looked up sharply. What? 50 combat medics and surgeons transition out every month. Most struggle to adapt to civilian protocols. Many leave medicine entirely. Voss's expression softened. You've done both, served with distinction, and integrated successfully into civilian practice. You can teach others how to make that bridge. Reeves was already nodding. We've been discussing this internally. The hospital administration is fully supportive. I came here to forget, Liv said quietly. No. James Chen's voice came from the doorway. He stepped inside. Danny Ortiz behind him. You came here to heal. There's a difference. Danny moved to the table. There are 50 former combat medics in this city alone. Most of them think their skills don't translate, that they're only good for war. He looked at Liv. You could show them they're exactly what civilian medicine needs. Liv stared at the document. A formal proposal, funding, curriculum development, a program that would teach military medical personnel to adapt their skills without abandoning what made them effective. I don't know if I can, she said. You saved 3 lives tonight, Reeves said. Using skills most civilian doctors don't have. Those skills came from places you'd rather forget, but they're part of who you are. He paused. You can't erase the past. But you can use it to build something better. Liv looked at each of them. Reeves, who'd gone from dismissing her to advocating for her. James and Danny, who recognized her story because they'd lived versions of it themselves. Colonel Voss, offering vindication 3 years too late, but still meaningful. 3 conditions, Liv said finally. Reeves smiled slightly. Name them. 1. I run the program my way. No bureaucratic interference. Agreed. 2. We create veteran-specific trauma protocols, fast-paced, high-acuity, designed for people who are used to making split-second decisions. Already in the proposal. 3. We partner with the VA. Every veteran who comes through this program gets the same level of care as any other patient. No exceptions. No second-class treatment. Voss nodded. The VA has already committed funding and resources. Liv picked up the pen, hesitated for just a moment, then signed. 3 months later, the simulation lab hummed with activity. 15 residents, 8 of them military veterans, worked through trauma scenarios with the intensity of people who understood that seconds mattered. Liv stood at the front, demonstrating a field tourniquet application on a mannequin. Yopi assisted, now her peer rather than her junior, having fast-tracked through the program with Liv's mentorship. Speed matters, Liv said, but precision matters more. You can have both. She demonstrated the technique again, slower this time, letting them see each movement. A new resident, a former Marine named Jake Torres, watched with the careful attention of someone trying to memorize every detail. His sleeves were pulled down over his forearms, hiding something he wasn't ready to share. Liv noticed. She noticed everything. After the session, she pulled him aside. "You're covering a tattoo," she said quietly. Jake's eyes widened. "How did you—" Liv rolled up her own sleeve, revealing the burn scars and the 160th SOAR insignia beneath. Names etched around it. Crew members lost. "I hid mine for 3 months," she said. "Know what I learned?" Jake stared at the tattoo. "The things we survive don't make us broken. They make us prepared." She pulled her sleeve back down. "You don't have to hide who you were to become who you are." Jake nodded slowly, and for the first time since arriving, he looked like he might actually believe it. 6 months after that conversation, the program had grown beyond anything Liv imagined. The simulation lab ran training sessions 3 times a week. 23 former combat medics and surgeons had completed the transition program. 12 were now working full-time in trauma departments across the Pacific Northwest. The statistics spoke louder. Outer than any promotional material ever could, trauma survival rates at participating hospitals increased by 23%. Average response times decreased by 40%. Patient satisfaction scores, particularly among veteran populations, climbed to record highs. Numbers didn't lie. The program worked. Liv stood in the main conference room, preparing for rounds. Outside the window, Seattle woke up slowly under gray morning light. She'd learned to appreciate this city's quiet rhythm, so different from the hypervigilance required in combat zones. Her phone buzzed. A message with a photo attached. Eric Holloway stood in the frame, grinning, arms around 2 small children. Twin daughters, maybe 4 years old, identical smiles. The message read, 6 months post-op. Girls turn 5 next week. Thank you for making sure I'd be here to see it. Liv saved the photo. Eric sent one every month. A reminder that the work mattered beyond the operating room, beyond the immediate crisis. She'd started a folder of them. Emma Patterson at her first day back to school. Robert Lawson at his daughter's wedding, walking her down the aisle with a heart that shouldn't have kept beating but did. Others she'd operated on during those chaotic 12 hours when her past and present collided. Each photo was a life that continued because someone refused to give up. The door opened and Yuki entered, carrying 2 cups of coffee. "Big day," she said, handing one to Liv. "You ready?" "As ready as I'll ever be." Today, Liv would present the program's findings to a national conference of trauma surgeons. Dr. Okonkwo had arranged everything, and the Department of Defense was sending representatives. If the presentation went well, the program could expand nationwide. 12 hospitals had already expressed interest. Hundreds of transitioning military medical personnel could benefit. But first, Liv had morning rounds. The team assembled in the trauma wing. Yuki, James Chen, Danny Ortiz, and Jake Torres, who'd stopped hiding his Marine Corps tattoo and started wearing it like armor. He'd become one of the program's strongest advocates, mentoring newer veterans through the transition. "Patient updates," Liv said, pulling up the board. They went through each case systematically. A motorcycle accident from last night, stable but requiring observation. A construction worker with a crushed hand, scheduled for reconstructive surgery. A teenager who'd survived a drive-by shooting, recovering well but traumatized. The teenager, Marcus Williams, Jake said. "He's having nightmares. Keeps asking if the shooting was his fault." Liv nodded. "Survivor's guilt. It's common after violent trauma. Have psych eval him today, and let's set up ongoing counseling." "Already scheduled," Jake confirmed. They finished rounds and dispersed to their assignments. Liv headed to her office, where Colonel Voss waited with Dr. Okonkwo. "Captain Brennan," Voss said, standing. She still used the military rank out of habit. Liv had been discharged for 3 years. "Colonel, Dr. Okonkwo." Okonkwo gestured to the chair. "We have a proposal. Bigger than anything we've discussed before." Liv sat. "How much bigger?" 47 hospitals across 12 states, Voss said, opening a tablet. "The Department of Defense wants to implement your curriculum as the standard transition protocol for all military medical personnel moving into civilian practice." The number hit like a physical weight. 47 hospitals. Thousands of veterans. "That's not a program anymore," Liv said quietly. "That's a system." "Exactly." Okonkwo leaned forward. "You'd be designing the framework for how this country integrates combat medical experience into civilian healthcare. It's unprecedented." Liv looked at the tablet, at the maps showing hospital locations, the projected numbers, the funding commitments. It was everything she'd hoped the program could become, multiplied by factors she hadn't dared imagine. What would my role be? National Director, Voss said. You'd oversee implementation, train regional coordinators, develop standardized protocols. You'd still operate here part-time, but most of your work would be administrative and educational. I'm a surgeon, not an administrator. You're both, Okonkwo said. And right now we need the administrator more than the surgeon. Liv stood and walked to the window. Below, an ambulance pulled into the bay, lights flashing but no siren. Controlled urgency. Someone needed help, but it wasn't a race against seconds. I came here to practice. Medicine, Liv said. To operate, to save lives one patient at a time. And you'll still do that, Voss replied. But this lets you save lives in multiples. Every veteran who successfully transitions because of your program is someone who'll go on to save hundreds more. Liv turned back to face them. When I left the army, I swore I was done making decisions that affected hundreds of people, done carrying that weight. This isn't the same, Okonkwo said gently. You're not deciding who lives and dies in triage. You're teaching people to save lives with the skills they already have. The difference was subtle but profound. Liv looked at the tablet again, at the scope of what they were proposing. Part of her wanted to refuse, to stay small and local and manageable. But another part, the part that had pulled 8 soldiers from a river and refused to abandon them, recognized an opportunity that didn't come twice. I want Jake Torres as deputy director, Liv said. He understands the transition from the inside, and I want Yuki Tanaka managing the Seattle site. Done, Okonkwo said immediately. I want full autonomy over curriculum design. No military or hospital bureaucracy overriding medical decisions. Already in the contract. And I want 1 day a week in the OR, non-negotiable. If I'm going to teach this, I need to stay sharp. Voss smiled. We expected that condition, already approved. Liv looked between them, at 2 women who'd taken a chance on someone with a complicated past and an unconventional approach, who'd believed that combat experience could translate into civilian excellence rather than just trauma to overcome. Then I accept. The national conference took place in a hotel ballroom that felt too corporate for the subject matter. Liz stood backstage, listening to the introduction, her presentation cued on the screen. Dr. Olivia Brennan served 8 years in the 60th Special Operations Aviation Regiment, performing over 600 combat surgeries with a 94% survival rate. She now leads the nation's first comprehensive military-to-civilian medical transition program. Please welcome Dr. Brennan. She walked onto the stage to polite applause, facing an audience of 300 trauma surgeons, hospital administrators, and military medical personnel. The presentation lasted 40 minutes. She showed data, case studies, testimonials from program graduates. She talked about Jake Torres, who'd almost left medicine entirely before finding a place that valued his combat experience. About Danny Ortiz, who'd struggled for years before discovering that his military training made him better, not damaged. She showed Emma Patterson's drawing, the one where Liv had angel wings. I didn't save Emma because I'm special, Liv said. I saved her because I had specific training that matched her specific injuries. Training I received in places I'd rather forget, treating patients in circumstances no one should face. She advanced to the next slide, showing survival rate improvements across all program hospitals. Military medicine teaches us to make split-second decisions with incomplete information under the worst possible conditions. That's not a liability in civilian practice. That's exactly what trauma medicine requires. The audience was silent, attentive. We lose talented medical professionals every year because they think their combat experience is a burden to overcome, rather than expertise to integrate. Liv looked across the room. This program proves otherwise. Veterans don't need to forget who they were to become who they are. They need systems that recognize their value. She clicked to the final slide, a photo of the Seattle team, veterans and civilians working side by side in the simulation lab. Excellence comes from embracing who you are, not hiding it. Medicine needs diverse perspectives. It needs people who've practiced under fire and in resource-scarce environments. It needs the ones who don't quit when the situation looks impossible. She paused, because sometimes Impossible is just another word for not yet solved. The applause started slowly, then built. Several people in the audience stood, and others followed. Liv remained at the podium, accepting the recognition with the same quiet competence she brought to everything else. After the presentation, dozens approached with questions, proposals, partnership ideas. By the time Liv escaped to the lobby, her phone had 17 new messages, and her email had crashed from volume. Yuki found her near the hotel bar, looking exhausted. Sad but satisfied. "That was incredible," Yuki said. "You changed the conversation." "We changed it," Liv corrected. "This isn't about me. It's about everyone who's been told their experience doesn't count." Her phone buzzed again. Another message from Eric Holloway, this time a video. His daughter singing happy birthday off-key, him beaming in the background. Liv smiled and showed Yuki. "This is why it matters. Those kids get to grow up with their father, and Marcus Williams gets to heal without carrying guilt that isn't his, and Jake Torres gets to practice medicine without hiding who he was." Liv pocketed her phone. One person at a time, until it's a system. 8 months after accepting the national director position, the program operated in 47 hospitals. Over 200 military medical personnel had transitioned successfully. The VA reported a 40% decrease in former combat medics leaving medicine within their first year of civilian practice. Liv still operated 1 day a week at Swaddle General, still taught in the simulation lab, still mentored residents who needed someone who understood what it meant to carry impossible weight. On a Tuesday evening, she finished a routine appendectomy and found Jake waiting outside the OR. "We've got a situation," he said. "Multi-vehicle pileup on Highway 5. Mass casualty alert. All hands." Liv was already moving toward the trauma bay before he finished speaking. The old instincts never fully disappeared, just waited quietly until needed. The ambulances arrived in waves. Liv coordinated triage alongside Reeves, their partnership now seamless after months of working together. Jake and Yuki managed individual bays. Danny Ortiz brought in the critical cases, calling out injuries with the precision of someone who'd seen too many. A young resident, first week on trauma rotation, froze when confronted with a patient in full arrest. "I don't know if I can do this," she whispered. Liv appeared at her shoulder. "Yes, you can, because we don't quit. Not when someone needs us." She guided the resident through the procedure, hands steady, voice calm. The patient's heart restarted. The resident's hands stopped shaking. "How did you stay so calm?" the resident asked afterward. Liv adjusted her sleeves, the gesture automatic now. Practice, and remembering that panic helps no one. She walked to the next bay, where Reeves was closing on another successful save. "Nice work," she said. He looked up, smiled slightly, learned from the best. "You were already good. I was adequate. You showed me what excellent looks like." By midnight, the trauma bay had quieted. All patients stabilized, families notified, paperwork completed. The team gathered in the break room, exhausted but satisfied. 7 critical patients, Yuki said, reviewing the board. 7 saves. That's unheard of for a mass casualty event. "That's what happens when the team knows what they're doing," Jake said. He'd operated alongside Liv on 2 of the cases, his military training translating seamlessly into civilian success. Liv's phone buzzed. A message from Dr. Okonkwo. "European Union Medical Services wants to discuss implementing the program internationally. Thoughts?" She stared at the message, at the scope continuing to expand beyond anything she'd imagined that day in the locker room, when she'd been just another first-year resident hiding her past. "What's wrong?" Yuki asked. "Nothing's wrong." Liv pocketed her phone. "Everything's just getting bigger." "Is that bad?" Liv thought about Emma Patterson, healthy and thriving, about Eric Holloway's twin daughters turning 5, about Jake Torres teaching a new generation without shame, about every veteran who'd found a path back to medicine because someone showed them it was possible. "No," she said finally. "It's exactly what's supposed to happen." Later, alone on the hospital roof under Seattle's perpetually gray sky, Liv heard the distant thrum of a helicopter. Medical evac, probably heading to Harborview. She didn't flinch, didn't tense. Just listened as the sound faded into the city's ambient noise. Her radio crackled. "Dr. Brennan, we've got incoming trauma. We need you." She smiled slightly, turned back toward the stairwell. "On my way." The door closed behind her, and the city continued its rhythm. Ambulances and heartbeats and second chances. Medicine practiced by people who understood that excellence came from embracing every part of yourself, even the parts forged in places you'd rather forget. Night Stalkers don't quit. Neither did she.